morning.
Hi Margaret, how are you?
Not so bad, thanks.
Good, my name is Gill Glynn, I'm the student physio here in Blythe.
Okay.
Can you just confirm your full name and date of birth for me, please?
My name is Margaret Hamilton, 2nd of the 4th, 1948.
Lovely. Okay, Margaret, so you understand why you're here today?
Yes, I do, yeah.
Right, so my job is just to go through with you why you're going to be attending pulmonary rehab.
Okay.
And the benefits and everything that you'll gain from it.
Brilliant.
Okay. So what we're going to do is I'm just going to describe what actually happens.
Okay.
Your program will be approximately 6 weeks, and you must be able to attend at least 2 times weekly. Is that okay with you? You think that's something that you'll be able to manage?
Yes.
Because in order for to see some progression and for the program to be effective, you're going to need to have a good attendance rate as well.
That sounds good.
Right, so now that we're clear that that's fine. So in pulmonary rehabilitation, the first hour is our exercise-based class where we incorporate resistance and aerobic sort of stations where you get regular breaks, we tell you exactly what to do, it's nothing too intensive. The reason why we do is to build up your muscular strength, to obviously enhance function and things for when you're at home, daily activities, to improve your cardiovascular system, so the strength of your heart and for circulation and everything like that. And an hour after doing the exercise class, we have an educational class.
Okay.
Where each week will be a different topic. So first week we'll be discussing respiratory conditions, so COPD, the pathology, the cause of it, and symptoms and things like that. Other topics we cover are a medication, coping strategies, stress and anxiety, and various different topics like that.
Okay. So
the reason why, as a physio, our role is to encourage and motivate you to exercise, and the reason why we've done out this pulmonary rehabilitation program is because it has numerous studies which have proven its effectiveness for people such as yourself with COPD.
Okay. So
in the exercise class, we'll be getting you to do both resistance and aerobic, and you'll be having breaks between, and it's going to enable you to improve your exercise tolerance and strength and everything like that, because I already know your exercise capacity is a little bit reduced, isn't it?
Yes.
So you're only managing 40 metres outside.
Yes. You
require assistance with the stairs, don't you?
Yes, that's right. So
our goal is to, by the end of the programme, hopefully, to improve the amount that you can walk outside, to improve your independence and your ability to walk upstairs without having assistance of somebody around.
Okay.
So in a nutshell, you're improving and gaining a bit more independence, and that's something that you want. Am I correct in saying that?
Yeah, absolutely, yeah.
Lovely. Okay, so our goals are that we're going to improve your fitness levels, which will improve your independence and things. So not alone. So not just improving things like that. Pulmonary rehab will also focus on your psychosocial aspects and things like that. So I understand with COPD, you might be suffering from a little bit of stress or anxiety.
Yes.
When you're trying to move around and things, you get short of breath. So shortness of breath is really common with our COPD patients, and it can cause numerous other problems. So panic attacks, anxiety, isolation. You're not inclined to leave home and things for fear that you'll go short of breath. So we incorporate and we provide a lot of training and advice for coping strategies. So we'll teach you how to do some breathing control techniques, right? And we'll also teach you some pacing, which is slowing down your activities throughout the day, planning your day better, and preventing you from reaching that threshold where you feel you're short of breath, and then that spirals sort of anxiety and stress and things.
Okay. So
throughout this program, we will be educating you and giving you advice on also relaxation techniques and things. Does that sound good to you?
Yeah, that sounds good.
Lovely. Okay, so by the time the program is finished and you're ready to be discharged, you'll be retested, so on your fitness level and your exercise tolerance and capacity. And you'll also be given another questionnaire where you fill out, which is anxiety and depression based questionnaire.
Okay.
Very general, very simple, There's nothing complicated or complex about it. It just gives us a good general just an idea of how you've progressed throughout the programme, okay? But the incentive of doing this programme for you is to enable you to be able to self-manage, because as you're aware, COPD is something that you will have for the rest of your life. However, it doesn't mean that you cannot improve your quality of life. So as a physio, we're here to ensure that you're getting the best possible advice, encouragement, and we're giving you that bit of a push and helping you to cope at home long term to deal with COPD, and you will do so by by simply doing these breathing control techniques, relaxation strategies, and also most importantly your exercise components. So we'll be advising you to sort of keep up. From little exercises we do in pulmonary rehab, we would expect that that's something you follow through and keep doing that on a weekly basis at home, because otherwise you'll deteriorate. And we're also aware that you've lost quite a bit of weight, and you've lost 3 stone, which is quite significant as you know yourself. So not to worry, pulmonary rehab and exercise is not going to make you lose any more weight. It's only going to gain muscle mass, which is healthier in the long run, and we'll also provide you with some nutritional advice, or refer you on to a nutritionist if need be, if you feel that you require further information regarding nutrition and feeding and eating habits. Okay, so Margaret, so that's just a brief overview of pulmonary rehab. Okay.
Great, yeah.
So for each session that you come in, you'll be given a diary, and there'll always be a physiotherapist there. I'm the student physio. I'll be there at least once a week as well.
Okay.
If you have any questions or concerns, there'll always be someone there. Have you any questions or concerns as of now? Anything you'd like to ask me here?
No, I think you've covered everything, so that's brilliant.
Right, okay, so what I'm going to do is going to bring you into the hall where the rehabilitation, where we do the exercise and things. I'm just going to give you an introduction and show you around and some safety procedures.
Great.
Get you to fill out some forms and things for us, and I'm going to introduce you to the other staff members, okay?
Fantastic.
Lovely, thank you for your time today.
Thank you.
Okay?
Yeah. Oh, that was really good, Jill. That was really good.
It's still recording.